Yes, we've been partnering with Arcadia since before my time, many years before I joined the organization.
Part of what I personally love about my relationship with Beth Israel Lahey is that they truly understand what partnership means. And partnership is not all rainbows and unicorns. It's a lot of hard work, sleeves up, nights and weekends to innovate together.
There's rarely a time that we've said, we need to do a thing, and Arcadia hasn't said, sure, we can help with that, or that's on the roadmap.
Beth Israel Lahey, a major player in the market, but a very, very competitive market.
Sure is, yes. Massachusetts healthcare is certainly a very competitive market. We've been in the game a long time. We have a lot of experience in terms of value-based care.
They've been engaged in Medicare Advantage risk, commercial risk, Medicaid risk, Medicare risk, years and years and years before most other provider organizations in the country. And not only are they engaged, but they're succeeding.
The strong foundation of data that we have with Arcadia has really helped us to identify early different ways that we can act upon the things that we're seeing in the data. And we're able to drill down to a level that we can really figure out the levers that are going to really help to make an impact.
The world of healthcare as it exists now, the edge is data, right? There is no understanding of your relative position, market grab of patients and membership and employers, and your performance from a cost, risk, and quality standpoint without data.
The data that Arcadia provides definitely helps us to look at our performance more real time.
Speed to insights is paramount. Beth Israel Lahey has a pulse on their organization 90 to 180 days earlier than a lot of other organizations within the market.
The foundation of data that we have within Arcadia allows kind of a more empathetic approach for the providers, a more holistic view into many of our patients.
Together, all of these millions of bits of data create a mosaic that approximates truth, and I think that truth is foundational for empathy, because if you don't understand what your patients are going through in a real longitudinal way, you can't provide empathetic care and think of a whole person, whole patient care delivery model.
For my team and the work that we do, we constantly bring it back to that patient experience, that patient level of, somebody's grandmother is on the other end of these ones and zeros and this BP and A1C. I do what I do because I love helping the people who help people.
What I wake up every day for is problem solving with a bunch of big, beautiful brains, right? And that is what I get with Beth Israel Lahey, are people that I can get on the phone with and crack open a really hairy problem and get to the bottom of it. If we weren't working on, one of the biggest economic challenges facing the United States, frankly, it wouldn't be that interesting.